Hi, I'm Dr. Stephen Henderson, chiropractor at Focal Point Chiropractic in Pineville, North Carolina. Today I want to talk about scapular stabilization. Scapula is the shoulder blade. And a lot of times we have a tendency in our society when we get under stress to draw our shoulders up, and this pulls the scapula up and it causes us to round our backs, and this can lead to a lot of neck tension because we're relying on the neck muscles that are supposed to be holding up our heavy head to also move our shoulder. One of the exercises we can do that's going to maximize the use of stabilizing the scapula is simply do an inverted push-up with the fingers toward the ground. We want to do this against a wall, not necessarily on the floor, and we want to kind of take our time and make sure that we're doing it correctly. There are two tools we need to do this other than the wall. We can either do this with one of these exercise balls or with a foam roller. With the exercise ball, we're given a little more instability. We want to set it down on the wall at belly button height and put our fingers pointed toward the floor and come out an elbow's distance. We want to round our back, keep our chin in, come forward onto our hands, and then push back against. This doesn't look like it's very difficult, but you'll be surprised whenever you discover how hard it can be. With a foam roller, again, belly button height, setting it on the wall, fingers toward the ground, coming out our forearms length away, rounding the back, coming forward, and then pushing back. We want to make sure we get a straight range of motion through the arms. We don't want the elbows winging out like this, for instance. We want them to come straight back, and we want to come straight forward. You want to do 3 sets of 10 of these to build up the habit of setting the scapula onto the shoulder blade. Another way we can do this is when we go to lift things, we can think about rolling the shoulders back and scooping things up from underneath. This is going to train us to use the shoulder in the way it is best designed to work.